Welcome to your Aged Care Compass podcast. Join us to find out how to support your older loved ones at home. We're going to help you make sense of Australia's aged care system. We talk about legal and financial considerations for ageing and how chronic health conditions impact your older loved ones' well-being. And we share real-life stories of where it went wrong for people and how we got them back on track.
Let's talk about home care packages. If you've heard our previous podcasts, you'll remember that a home care package is an allocation of funding that is for the person it's assigned to. A home care package offers people much more flexibility with the services and supports they need. In this episode, we'll be covering how to be approved for a home care package, choosing the model of service provision, what care planning is, what valid care expenses are, and the value of clinical input. So, Coral, let's get started with who approves for home care packages.
Home care packages are approved by the Aged Care Assessment Teams, or ACATs, or if you're in Victoria, it'll be the Aged Care Assessment Service or the ACAS. When you call My Aged Care, which is the gateway to government subsidised aged care services and support, you can't actually request an ACAT assessment straight up. So My Aged Care will be screening you, and based on the detailed and compelling or not information that you've provided them, it's My Aged Care who determines whether you get an ACAT assessment or not. There are 4 levels of home care packages and 3 levels of priority. When My Aged Care approves you for a home care package, they'll approve you for either a level 1, 2, 3, or 4 home care package. So a level 1 equates to fairly basic needs, and the current value at April 2024, the current yearly subsidy for a level 1 home care package is just over $10,271 per year. And that goes right up to a level 4 home care package. And the current funding or subsidy for a level 4 package at this time is just over $59,593 in a calendar year. So just to be mindful that these yearly sums, these yearly amounts of funding aren't provided in one initial sort of payment or allocation. These figures, these amounts of funding are allocated on a monthly basis. The funding doesn't get deposited into a person's bank account. The funding must come via a provider. So the home care package provider that you choose is the conduit for your funding to become available for you, for your in-home needs, services and support. At the time the ACAT is approving you for a level of home care package, they're also approving you for a level of priority, which essentially means how long you might be able to wait before you receive that home care package. It's a very tricky area because it can change. So at this point in time, if you're approved for a level 1 home care package at a medium priority, a level 1, there's more funding available for those level 1 home care packages. There's more of those entry-level packages available. The advice is that you'll be waiting for less than a month to have your level 1 home care package assigned to you. A level 2 is 3 to 6 months. A level 3 home care package has just tipped out to 9 to 12 months wait time, so up to a year before you could be allocated your level 3 home care package. A level 4 at the moment is still 3 to 6 months. So these timeframes here are reflected of a person being approved as a medium priority to have their home care package allocated or assigned to them. If the ACAT sees a need for urgent support, like if there's a situation where a carer isn't able to fulfill their caring role anymore, perhaps something's happened to them and they're in hospital, or perhaps they have moved away and they can't support that person, or if the older person that's being assessed lives by themselves and that makes them very vulnerable and there's a high risk that if they don't get that formal support in, they might end up in hospital or have an adverse outcome. There might be a fall, something catastrophic. The ACAT can approve people at a high priority. So the difference between a medium level of priority and a high level of priority, that equates to the wait time. So those wait times that I just mentioned before, 3 to 6 months, 9 to 12 months, they are typical of a medium priority. Now, if a person needs help sooner rather than later, the ACAT can approve them at a high priority. And what that means is it significantly reduces the time a person has to wait to have their home care package assigned to them. So where a medium priority might be a 3 to 6 month wait, a high priority could be 1 to 3 months. So in essence, it pushes the person right to the front of the national queue or the priority queue, reflecting the priority or the urgency for that in-home support, and a person will be assigned their home care package much sooner.
So, Coral, if someone gets assigned a home care package, what if they don't agree? What if they feel their needs are perhaps, say, at a higher level than they've been approved for, and they believe that they just don't agree? What happens?
You can certainly appeal that decision. So in the first instance, you would go back to the ACAT admin and ask to speak to your assessor, and you would know what their name is because hopefully you've written it down somewhere. So you would have a chat with the assessor, and you may also speak to the team leader of that ACAT or the delegate, who's another ACAT assessor but has higher levels of responsibility. So as a delegate, they're signing off on what the ACAT assessor is suggesting. So you would speak to someone within the ACAT team, and you don't go back and say, I don't agree with that. You should have approved me at this level or this priority. You have to have all your evidence there. At every step along the way in this system, it's all about demonstrating the need, having the evidence there, being detailed and compelling with the information that you're putting across. If you didn't agree with the ACAT, certainly you would start with that team, the ACAT or the ACAS, and tell them why you didn't agree with it. Now, at that point, the ACAT might be receptive. Your information might be very good. It could be something along the lines of the ACAT perhaps may have assessed the older person, and the older person might be cognitively impaired and actually portrayed a situation that wasn't true of what was really going on at home. And then if the adult son or daughter or the spouse realizes that, oops, a whole lot of information was missed, then that's what you would be saying to the ACAT at that time. So the ACAT can then decide if your reasons are valid, and they could change the level of the home care package or the priority. If the ACAT's unwilling to do that, then you do have to write to the Secretary of the Department of Health and Aged Care and put your reasons in writing. And you have 28 days to do this. So, that can be a protracted kind of process. So really what you want to do is get it right. Get it right when you're being assessed by the ACAT. So it doesn't leave any room for error. But should it not be entirely correct, then you would have that conversation with the ACATs. And look, the ACATs are really good. They understand that sometimes all the information isn't given, portrayed for whatever reason. And if you can get that information across, typically they're very reasonable about it. The ACAT doesn't want you appealing to the Department of Health and Aged Care as well. So, but should it come to that, when you get your approval documents in the mail from the ACAT, it will have the information about how to appeal and the contact details for the Secretary of the Department of Health and Aged Care at the bottom of that documentation.
And let's assume then that somebody has received, so they've received that first letter saying that you have been approved for a certain level of home care package. Then they get that second letter that says, in about 3 months, we expect your home care package to be assigned to you.
Mm-hmm.
This is where we say to people, now is the time to start researching providers.
Yep.
So I guess a couple of things. The market has changed a little bit in recent years. So it's not just providers now. There's a couple of different management options, aren't there?
There are different service provision options. So the one that was sort of first into the market, the one that people are most familiar with is called fully managed or a traditional, which is where you would choose your provider for your home care package and you would sign up with them and they would coordinate all the support that you needed and all the services. Some years ago, there were other providers who offered an alternative model, and this is called self-managed. Self-managed means that it cuts out that middle person, it cuts out that care coordinator, and it means that you take on board the responsibility for sourcing and coordinating either your own care, the services and support that you get, or you're doing it on behalf of a loved one. Very, very different models. With self-management, initially a lot of people said, go self-managed, the admin fees are a lot less, you can make your dollar go further. In a way, that's kind of true. Typically with providers, like if you did choose a fully managed provider, your combined fees would be capped at 35%. And what that means is the provider can only charge 35% of the value of your package or your subsidy to charge in their admin fees. If you go with a self-managed provider, it typically sits at around 15%. So, you might be saving as much as 20% in those fees, but you're doing the legwork yourself under self-management. Either way, what if you sign up with a fully managed provider or a self-managed provider, again, the money does not land in your bank account. It still has to come via a provider, even that self-managed provider who manages and then who ensures the compliance and reports back to the department about how your funding is being spent for you.
And Coral, I guess both models have their pros and cons, don't they?
They do. And look, Shell, one of the things, we talk about this with Dad with his level 4 home care package. We were with a fully managed provider for Dad because Dad's needs were so high with his dementia. And we were all working at that time as well as supporting Mum and Dad. And honestly, none of us had the time, the ability to coordinate all his support and his services for him. So at that time, having a fully managed provider do that on our behalf was absolutely the way to go.
Yep.
But with Mum is not cognitively impaired, and although she still has really high care needs, it's not, I guess, kind of taxing in a way with time and emotion as it was for Dad. And, a self-managed model does work for Mum. So I support Mum to self-manage her level 4 home care package. She couldn't actually do it herself because she's just not savvy enough with technology and just doesn't have the insight or the understanding of how it all works.
Yes.
So, I can do that for Mum. It is time consuming. I'm going to be honest about that. But it works for Mum because with the kind of needs that Mum has, and Mum has a lot of clinicians involved with her support and her care provision, it means that I can respond very quickly to her needs and I can make those referrals. And so we can get any clinical support in any services that Mum needs. I'm able to arrange that really quickly. So we're not relying on a coordinator who might have 60, 80, 100 other clients to deal with. I can get that done and get that actioned in a very short period of time for Mum. And in doing so, it does also, I think for Mum, certainly for me supporting Mum, provides a lot more flexibility and choice under self-managed versus fully managed. So certainly pros and cons. And I always say to people, you shouldn't make your decision based on what that admin fee. Having someone do it all for you is absolutely appealing for people who just don't have the time or the resources to do all that. So, a few different considerations there, and it really shouldn't come back to actually what the dollar is, unless that's what your priority is. But
It really
you know,
should be more about the level of support and the level of care that you're going to get.
It should, yeah.
Yeah.
And reflecting your own situation,
Yeah,
just
absolutely. And I
what
guess we say this to everybody. We acknowledge that self-managed is not for everybody.
it's not. It's a great option for everybody. And even us who knows the system so well could never have self-managed dad's home care package.
No.
So you have to make the decisions that are right for you and your circumstances.
Yep. And when someone signs up with a provider, and this covers regardless of what model of management we're talking about, that first document that is produced, the care plan, Coral, can you talk about what it is and why it's so important?
So, like you said, Shell, whether you sign up with a fully managed, traditional, or a self-managed provider, the document that underpins what services and support you'll receive is your care plan. So the provider will have either a coordinator who's an admin person, or they might have a coordinator who is a registered nurse, which is what I really like to hear. So for me, just reflecting on that conversation we had about cost or the admin fee not being the only reason, the deciding factor in why you would choose a provider, I do actually say to people, if there's a registered nurse who's writing your care plan, from my perspective, that's very favourable. So
Yes.
the care plan needs to be written within 2 weeks of signing up to a provider. And the care plan is a very detailed document. It must be developed in conjunction with you. A provider cannot write your care plan without your input. Potentially, there should be a draft care plan that you get to see before you sign off on it. And then, of course, if you're happy with it and your provider's happy with it, then you'll sign off. And for the next 12 months, if nothing changes, that's the guiding document that supports the kind of services and support that you're going to receive at home.
Coral, what sort of information is put on a care plan?
As much information as possible. So, the more information that you can give your provider, the more detailed your care plan will be, and the easier it makes it for your provider to say yes when you want to utilize your funding in a certain way. And that might be with engaging a clinician or some kind of support, or perhaps using your funding to make some kind of purchase, whether that be a mobility aid or some other assistive technology. For me, being a registered nurse, it's a no-brainer that you share your medical information with your provider, because your medical information really reveals a lot about potentially where you are now and what your health conditions are, how they're going to impact on you into the future. So let's take, for instance, diabetes. If someone who has type 1 or type 2 diabetes, we know that diabetes can cause a lot of complications for people. And one of them might be the nerves in their feet being compromised because of, high sugar levels over a period of time, and people can develop peripheral neuropathy. So if the nerves in a person's feet aren't as intact as someone that doesn't have diabetes, this could impact on someone's mobility. So as a registered nurse, I'm always looking at this. What kind of health conditions do you have? Because that gives me some insight into how that's going to affect your function, your mobility, pain, whatever it might be. Some people say to us that they're really uncomfortable sharing that information with their providers. And look, I understand that, but from where I sit, if someone comes to me with medical information, it makes my job so much easier, and I understand a lot better what that person's situation is. So getting across to your provider all sorts of information regarding what you're struggling with at home. And providers are generally good at teasing out this kind of information, support with things like pretty general things, domestic assistance, lawn mowing, modifications to the home. If you have issues with continence, it's really important to say that, because you could get if this is the sort of the first time, or if no one has discussed continence with you, your ACAT assessor probably would. But you need to be discussing it with the provider as well, because you might benefit from having a continence advisor who could be a registered nurse come and assess you. Or you may want to go and see a specialist physiotherapist who, who deals with continence to support you that way. And then if you need to purchase continence aids, you can certainly get the cost of that covered from your home care package. So it really comes down to the more information you can share with your provider, the better, the more detailed and the more comprehensive your care plan is going to be, which makes it easier then for your provider to say yes. If you say, hey, I'd like my package to cover this, can I get that done? If it's in your care plan, it's already done. The provider is more likely to say yes then.
And Coral, that could even be things that, may not be, I guess, obvious to the care planner or someone, say someone has, maybe they're struggling with low mood.
Yeah.
Or maybe they've got some visual impairment.
Yeah.
Things that aren't obvious. Again, they're probably things that are really important to mention as well. If
it's
somewhere along the way. Yeah.
Yeah, it's all important. The goal of these in-home aged care programs is to support people to remain well and able in their homes for as long as possible. So there are certainly some things that are off limits or excluded from using your funds for with a home care package, but your provider will tell you that. But you need to go on the front foot and give them as much information as you possibly can so they can work with you around strategizing how they can support you to alleviate that issue or make things easier in the home around that issue.
FlexiCare is a not-for-profit organisation which supports older people living in Brisbane's southern suburbs to live their best lives in their own homes and communities. FlexiCare don't have grand plans to be the biggest aged care provider. They want to be known for treating each one of their participants as an individual who they get to know well. They answer their phone calls personally when clients ring them. They give their clients easy access to a home care partner who can work with them to deliver the best mix of support possible. If you're in Brisbane South and want to know more, give their friendly team a call on 07 3422 8400 or check out their website flexi.org.au.
Just touching on the care planning, so we know we know when you sign up with the provider, they should really be developing that care plan within 2 weeks of you signing up with them. The care plan is supposed to be reviewed at every 12 months at a minimum. So there is that expectation that the provider follows up with you at the 12-month mark if nothing's changed. But if there's been a significant event, and we would think of something, if it changes, what you want to use your package funding for, how you want to use that funding, then you would be asking your provider to do a care plan review. And typically, if you start asking your provider to cover the cost of something that's not on your existing care plan, that should indicate that possibly your care plan should be reviewed. So significant events might be something like a fall where your mobility is significantly impaired. There's a change there. You may need some mobility aids after that. You might need some clinician support to literally help you get back up on your feet again. If you're needing modifications around the home, you might need an occupational therapist to do an assessment and then have whatever, ramps, grab rails, non-slip mats, whatever sort of modifications to the home that you might need. So at that point, and look, if you have just recently had the care plan developed and maybe a month or two later a significant event happens, you really need to be alerting your provider, because two things need to happen. If your care plan needs to be reviewed, and if the funding that is aligned with that level of home care package, let's say it's the level 2, if your needs have increased to such a point that $18,000, just over $18,000 currently, which is the subsidy for a level 2 home care package, if that's not going to meet your needs, then at that point you should be discussing with your provider about getting a support plan review. And what that means is you go back to the ACAT again. You and your provider convey what those change needs are, and then the ACAT goes, yep, okay, we can see that your needs have increased a lot, and a level 2 home care package is just not going to be enough funding to support you. We'll do a review and we'll approve you for a higher level of package. So again, that really good communication with your provider, keeping them updated as things change, means that you're putting them in the best position to be able to support you.
Yeah. And touching on that, Coral, so there really is, if there's been a significant change, there really is no minimum time frame. People can't say,
That's
well,
right.
you only had your care plan done a month ago.
Yep.
Well, if there has been a significant change, even just in that month,
yeah,
go ahead and speak about a
you know,
care
just
plan. Yeah.
if you've been approved for a level 2 home care package, that doesn't mean you sit on a level 2 home care package forever. We recognise that people's needs increase, and we realise that means that they have to go up to the next levels of home care packages. So being on a level 2, as your needs increase, you would go up to a level 3 home care package. And then when that level 3 home care package couldn't sustain the kind of support that you need, again, you would be asking for a support plan review. The ACAT would review you, and you would be getting approval for a level 4 home care package.
Yeah, yeah. And I guess one of the things that causes a lot of angst, a lot of confusion, and I would even say a lot of anger with people is when a home care provider might say no to a person's request. And I guess it's understanding what valid care expenses are and what the home care package can't be used for.
So yeah, again, just circling back to care planning, if you're asking your provider for something and there's no evidence in your care plan that what you're asking for can support your age-related functional decline, your provider will be reluctant to say yes because it's not in the care plan. So again, that very detailed, open communication with your provider and making sure that you have a very comprehensive, a very robust care plan gets you both off on the right foot. Now, when you're allocated your home care package, yes, you get this subsidy from the government aligned to whatever level of package you have. It's not a free-for-all. So the government is quite strict about what you can and can't use that funding for. On the whole, I think providers try to do the right thing, and you know, they want to support their clients to live well and safely in their own homes. But there have been some providers who probably have pushed the boundaries, probably a lot more than a little bit. And we're using home care package funding for things that weren't related to a person's age-related functional decline.
Yes.
So in January of last year, 2023, the department put out a document that, you know, was designed to simplify the decision-making process with providers. And there is a part of that document was an inclusions and exclusions list. What this did at that time, it did cause a lot of unrest in the sector with recipients of home care packages, because at this point it was, you know, there was some discretion prior to this, and providers could, based on the person's needs, they could sort of arrive at their own decision about what was appropriate and not appropriate use of package funding. But in this document that came out January last year, we have an inclusions and exclusions list, and it goes into a lot more detail. So providers who had previously said yes to some items now had to say no, because it was written in black and white, and those became the items that were now excluded of package funding. So people who previously had been getting natural therapies, you know, had been seeing a naturopath, or they might have been having, let's see, some therapies like Reiki or Bowen therapy. People who had little dogs and were getting their dogs washed, and mum was in this situation. She has a little dog, and if mum was to wash her dog, that's a high false risk for her.
Yep.
But in the inclusions exclusions list, the package funding can't cover for dog grooming, dog washing anymore. You can't have your naturopath supplements paid for from your package funding anymore. So It really did upset a lot of people whose package funding was covering these kind of items, and their providers had to say no at this point. Look, it still is causing a lot of unrest in the industry. People are saying it's unfair. I get it, but this is the situation that we have to deal with right now. So, yeah, the more detailed a person's care plan is, opens up much more possibility for people to use their package funding, but certainly to be mindful that valid care expenses relate to the inclusions, what people are allowed to use their funding for, and certainly not valid care expenses relate to the excluded items. And I think in our show notes, Shell, we might actually put some links to these documents so that people can go and take a closer look themselves and see the decision-making framework and have a look at that list of inclusions and exclusions. So they've got the time then to understand how this actually works.
So, Coral, if we're talking about care plans, obviously, you've already said that you find it very favourable if a registered nurse has the input on that care plan. Let's talk about the value of clinical input in the development of the care plan, Coral.
Yeah, so as I've mentioned, Shell, from my perspective, having a registered nurse draft the care plan is really, to me, it's like the gold standard.
Yeah.
But not all providers have the luxury of having a registered nurse on staff to do that. Why do I think it's really important? It's because a registered nurse understands the benefit of, they look at people holistically. So a registered nurse will be looking at a person's mobility, they'll be looking at their declining function, and taking a holistic view of a person. The registered nurse will then understand what's the best way to support this person. And that might be just in personal care, but it also might consider the benefit of getting allied health clinicians involved. So the RN will take a very holistic sort of general view when assessing the person and developing the care plan. And then the registered nurse will know who else should we consider? Who should we refer to be able to support this person to optimize their well-being and their function in their own home? And then the RN will incorporate those recommendations. It might be to have a physiotherapist or an occupational therapist or an exercise physiologist or a podiatrist, will write that into the care plan. So at that point, it doesn't mean that you're locked into using those clinicians at that point in time. If you're on a level 2 home care package, it's less than $20,000 in subsidy a year. So having a whole bunch of clinicians involved in your care is just not going to be achievable. Certainly on a level 3 and level 4 home care package, it would be. But by including it in the care plan, the option is there then, should you want to make yourself available to having that allied health practitioner support.
And a lot of that, Coral, it's preventative, isn't it? Or it could even be slightly re-abling. Having that clinician support.
Yeah. So this is where we're going with the reforms over the coming months and next year, is supporting people from a re-ablement perspective and meeting people's goals. So that kind of sounds a little bit intangible to a lot of people, like, what does that mean? And when people have a home care package and they're chatting with their provider, they often don't realize that they can get all that wonderful clinical support paid for by their home care package. So for me, my background being a nursing director in my hospital and health service and being involved in the implementation of transition care program, which is, we call it an interdisciplinary or a multidisciplinary team approach. It's a bunch of clinicians working together to optimize a person's function and well-being. Being part of an aged care assessment team or an ACAT for 9 years, that's a multidisciplinary team as well, a whole bunch of different clinicians working together. So all the projects that I've worked on, all the jobs that I've had over the years, this is where I love to work with other nurses, physiotherapists, occupational therapists, you name it. I just love that team approach to getting people well, or, maybe not if it's impossible to help them regain some level of function, then certainly stabilizing or retaining where they are now and prolonging that period of where they are going to decline. And to sort of make it easy for people to understand, mum's on a level 4 home care package. In the past 3 years, she has had 2 severe situations where she's been admitted to hospital, both emergency admissions to the hospital, one of them resulting in emergency surgery as well. So they weren't long hospitalizations for her, but the events that caused her to come into hospital were very significant. I mean, that emergency surgery, we got her to hospital just in the nick of time, or, mum would not be here today.
Had we waited, yes.
Exactly. So after mum came out of hospital, after both those 2 admissions, she spent many weeks with me in my own home because she was just so frail and deconditioned and just could not have gone home. And I remember at both times thinking, oh gosh, is this it? Can mum go home, or are we at the point now where she needs so much support that she's going to have to go into a nursing home? But me understanding the system, knowing what was possible, rather than getting carers in under her home care package who would help her with her shower every day and make her breakfast every day, my approach was one of reablement. So with mum's home care package, after both of those admissions, I used her funding to get a whole range of clinicians involved so that we literally were reabling, or we were restoring mum to her previous level of functioning before these health events occurred. So I got an exercise physiologist involved who comes to mum's home 3 times a week and does one-on-one exercise with her, which focuses on her strength and and means that she's regained that strength, that she doesn't need someone to help her in the shower. She can do that herself safely. It means having that exercise physiologist come to her home 3 times a week. She regained her strength. It was over many weeks, but she did regain it because she couldn't get in and out of a chair by herself. And look, she still can't if the chair doesn't have armrests or isn't height appropriate. She still does need some help. But if she's in an appropriate, like a high back chair, she can get out of the chair herself. So the exercise physiologist helped her to regain that strength. And in regaining that strength, it also helps with her mobility. So she was really wobbly on her feet because she was so frail. Yes, the exercise physiologist helped her to get stronger again, but also I looked at mum's feet at that time, and mum, as you know, doesn't have great feet. And her footwear could have been a little bit better. So I got her to see a podiatrist. When we talk about podiatry and aged care, people often just think someone to cut your toenails. But podiatrists can do so much more than that. So utilising mum's package funding, and of course, this was written in her care plan, we got mum along to a podiatrist who did a biomechanical assessment of her feet and really looked at her gait, which is how they walk, what happens when they're walking. From those assessments, then the podiatrist recommended supportive orthotic shoes as well as orthotic inserts into her shoes. So because that came off that, the package funding paid for the podiatrist to do those assessments, and then because the podiatrist, being a clinician, made that recommendation, the mum's package, the funding paid for those specific shoes and those orthotic inserts because it was optimizing her safe mobility and enhancing her well-being and contributing to her not having a fall.
And Coral, one of the really important things that came out of all of that too is we saw mum had lost her confidence after those hospital admissions. And with that clinician input, we saw that confidence come back.
Absolutely. Each time. Every time. And it's not just mum, Shell. It's so many of our clients who are unaware that by getting clinicians involved in their care and their support, it puts them in a really good position to stay well for longer.
Yes.
And look, there is that discussion in the sector about if there are other programs whereby you can get clinician support, that you shouldn't use your home care package for, that you should use those other programs. But, the big one that we're talking about is those GP management plans or team care arrangements where it allows people 5 subsidised sessions with an allied health clinician. It's only 5 and they're subsidised, so they're not free. So certainly a person could go via their GP and access allied health on one of those kind of plans, but they're still going to be out of pocket because Medicare doesn't cover the full cost of that service.
And you can't claim the difference, can you?
No,
Because
you
it's a
can't.
Medicare,
Exactly.
it's a
So you
Medicare
can't-
subsidised service.
That's right. You can't claim the difference on your home care package. So if a mum who gets 3 exercise physiologist sessions a week, we're talking, if you go onto a GP management plan or team care arrangement, 5 subsidised, there's just in 2 weeks it's certainly not enough for mum, and she needs that. So a valid care expense for mum is having these clinicians involved to keep her well and able, and being able to remain at home for as long as possible. The value, yes, I'm a clinician registered nurse, but for me, it's a no-brainer. Having clinical input when you have a home care package, and particularly those higher levels, those level 3 and level 4 home care package, for me, I think it's absolutely essential.
Yeah, totally agree. And we find also someone may have signed up with a provider, and as things are going along, they may be feeling that they're not getting what they want from, or the provider's promising but not delivering, or things just aren't working. There's just what the provider is offering and what the person is wanting are not necessarily aligning, and people want to change providers.
Yeah.
Can you talk us through that?
Yeah, so it's much more accepted and recognised now that if someone's not happy with their provider, they can move, and it's not that difficult. A lot of people, I say to people, if you're not happy with your provider, then why would you stay with them? If they're not delivering the support that you need, why do you stay with them? Like, they're not meeting your needs. So, you should probably think about moving to another provider. So I mentioned earlier with home care packages, the capping of the fee, and that came in January 2023. So another thing that happened in January last year was providers were not allowed to charge exit fees anymore. So prior to January last year, some providers who, they didn't want their clients to leave them, and so there was a little bit of, they might call it a ransom, I don't know, but they certainly we were aware of these providers who, when their clients weren't happy with them, wanted them to move, they wanted to move. And these providers told people that, yes, you can move, but we're going to retain an exit fee because we're entitled to. And we were hearing sums of money that were ridiculous. So we were aware there was a provider who was telling people that they would charge them $2,000 to exit their service provision and go to another provider. So this was, one of those unsavoury things that was happening in the sector. But from January last year, providers are not allowed to charge exit fees anymore. So it's definitely a good thing. If people are not happy with their service provision, obviously they need to talk to their provider first and try and get to the bottom of it. Now, if it's ongoing, if your provider just cannot deliver the support that you need, and you've had that discussion and it's just not working out, then you should think about moving to another provider. So you won't be charged an exit fee when you move to a new provider. You do have to give 2 weeks notice of intention. I encourage people maybe to have their research done, to give 4 weeks notice. You only have to give 2, but maybe 4 is more workable for you and your provider, because 2 weeks is so short. If you've decided that you want to move to a new provider, you have to make sure that on the day the services cease with your current provider, you don't want any sort of disruption in that service provision moving to a new provider. So you want to have the cessation date of your current or previous provider, and then the next date ready to go, so that your new provider can pick up and there won't be any disruption to your services. So 2 weeks is kind of a tight time frame, unless you've absolutely done your research, you've contacted the new provider and you've said, I'm discontinuing with my current provider on the 14th of April. I want to start services with you on the 15th, and you have all that work done so that your new provider can just pick up with relative ease and continue those services for you.
A lot of the providers will actually help people to change, won't they?
Do. They do. Look, sometimes they do and sometimes they don't. And I can't give all the reasons why, but your provider should help you. Whether they do or not, it's up to them. People need to be mindful that if they're moving to a new provider, how much of that funding have they utilised for that month with the previous provider? So that monthly subsidy will continue without disruption when you move to a new provider, but any unspent funds, if you have unspent funds, just say you have $10,000 that you haven't spent, that won't transfer immediately. So that gets held for up to 70 days by the current, well, by Services Australia, but it's so that the provider that you're presently with, if there are any invoices coming in or any fees that they have to disperse, that funding is available for them to do that. So there is that delay of up to 70 days. People need to be mindful of that as well. But if you do want to change your providers, it's not a difficult process. It just means you need to be organised, have done your research, and coming back to communication, be upfront with your current provider and have all those conversations all ready to go, have had them all ready, and then have everything set up with the new provider that you're going to move to.
And I think, Coral, understanding what you were unhappy about with your previous provider and not falling into the same trap again.
Exactly.
Really do your research. What's important to you? What's a deal breaker? What do you want from your home care package?
It does come back to communication, understanding what your needs are, being open with your provider. Like, I know a lot of people, there's a lot of trauma, a lot of anger with a lot of people who are unhappy with their package providers, but the responsibility of having that relationship with your provider, you have to take some of that responsibility yourself. So a good open dialogue, good communication, and keeping your provider updated as things change. If you have a good provider, your provider will work with you to meet your needs.
Yeah, so important.
They're the basics, I guess.
Yeah. Well, there we go. Hopefully everyone now is feeling far more confident about approaching a home care provider. So we'll look forward to everyone joining us next week. See you then. Hey, care community. Thanks for listening to this episode. So you never miss a show, make sure you subscribe to our podcast. If you'd like to know more about what we do, head to our website, cmeacn.com.au.